the healthcare professionals, and also research and providing research and technical supports to the people for through the grants, fellowships, and partnerships with flagship medical institutions, not only in India, but globally. We are also partner with very closely and work with very closely with Government of India and work towards transforming the health technology products, also the improve accessibility and equity of health services. On the left of the slide, you can see here our work focuses in 12 thematic areas. One is maternal and child health, which is one of my core area of work. Social determinants of health, I'll tell you what do we mean by that. Nutrition, disabilities, health system policy, financing, injuries, sanitation, non-communicable diseases, infectious diseases, environment and pollution, violence against women, and so on. These 12 thematic areas are the broader one, and we are recognized by a Department of Scientific and Industrial Research for our R&D activities. So PHFI academic program has a wide spectrum which focuses on the public health workforce, which are basically through the professional development program or short-term courses or short-term trainings. Skill enhancements program, which are often e-learning programs or on-campus programs and certificates. And we do have on-campus postgraduate and PhD programs. IIPHs have 5 centers currently functioning, started in 2008 and 9, more than 10 years we are now functional. And you can see here, started with single courses in 2008 and 9, and we are now offering every IIPH, Delhi, Gandhinagar, Bhubaneswar, Hyderabad, and Bangalore campuses, offering a range of the program, focusing on the different dimensions of public health. What do you mean by public health? As the previous, during the introduction, it is being said, it is an organized measure to prevent disease, promote health, and prolong life of the population as a whole. So we as a public health professional focuses on the health of the whole population, or at a district or at a block or at a state level, and work towards that through the different preventive and the promotive aspects. So let us understand first what are the core functions of public health. Public health professionals' function can be divided into 3 parts. One is the assessment, second policy development and policy analysis, and third is assurance. Let's see what do we mean by assessment. Assessment means that the public health professionals are involving assessment of community health needs. They also investigate the health hazards and its effect, and it analyzes the health factors which are correlated, and also factors beyond the health sectors which are correlated, which we call it social determinants of health. So you will appreciate that the health needs of the different population groups are different. So we can, for example, the infectious disease or any disease prevalence would differ in the as per the urban and rural setting, or in the slum and non-slum areas. some proportion of population will have a higher proportion of a particular disease. From the public health perspective, women and children are considered to be more vulnerable compared to the other adult population. So women in the reproductive age group, those who are getting pregnant or delivering children, they are most vulnerable, we consider them. So assessing the different health groups needs. Similarly, as I said, the pregnant women or the reproductive age women and the children will have different needs. Similarly, needs of the elderly population will be very different. So as a part of our health needs assessment, the public health professionals are actually involved in understanding the health needs of the different communities. They also investigate the different factors, say, for example, occupational injuries or lifestyle related factors or socioeconomic factors. What are these factors affecting the health hazards? And also we analyze them and give our recommendations. The policy development focuses on the advocacy for the community needs and issues. So should be related with the community needs and issues. Any policy which is launched should be decided based on the prioritization of health needs. I just would like to take the example of COVID-19, where because the problem affected the large proportion of the population, the policy actually focused more onto the prevention of the disease for the different population groups, and also it designed the various preventive and also curative measures. So public health professionals work very closely with policymakers, and they actually help in analyzing as well as development the policies. The assurance, that means the ensuring that all the groups of the population are able to get the health services equitably. The public health professionals are responsible for managing the resources efficiently. When I say managing the resources, this includes the management of human resources in the health, management of finances of the health, management of logistics at the health facilities. All kind of management functions includes in the public health management. The implementation program, wherein all the different initiatives, so say for example, the immunization program of Government of India or the ANC checkup program of Government of India, are implemented by public health professionals. They usually work in a managerial capacity and oversee the implementation program and ensure that these programs are implemented efficiently and reaching out to maximum population. The next function of public health professionals is the evaluate or assess the programs. Program assessment function focuses on basically the how these programs are performing. Say for example, whether immunization program, because immunization program or any other national health programs are lot of resources are invested into that to get the program rolling, and whether this program is actually beneficial for the population or not, this assessment is conducted by public health professionals. Also, it is a job of a public health professional to give the correct information to the public. Correct information, I mean, is the right information at the right time to the right audience should be reaching, and that is the job of public health professionals. It is said that public health is a wise investment because as I said, it focuses on prevention of disease rather than treatment of the disease. So we really work towards that. We have to adopt the preventive measures so less people get affected by the disease. They're able to enjoy the good health, and people should be able to live longer. So of course, we do need curative services and diagnostic services for the population, but at the same time, prevention actually can save a lot of money. By just prevention, we can actually avoid a lot of resource investment. So to be able to work in public health, we have to conduct a lot of research, and the public health research focuses on systematic investigation in any area. When I say systematic investigation in any area, I mean is the area which is of importance. So currently we are seeing, if we see the important public health problems of the country, the rising level of non-communicable disease is a problem, means overweight, obesity, hypertension, diabetes. Similarly, at the same time, underweightness, malnutrition, stunting is also a public health issue in many states of the India. So any such kind of any theme we can pick as per the interest of the people. We do prefer to do the systematic investigation by having to understand and to get the facts. These facts, in fact, actually help us in getting the idea about what changes are required and what changes for the betterment of humanities or betterment of health in sense. So to be able to actually realize this dream of a good research, we do need funds. We do need skilled manpower, but at the same time, we should also have felt the need for the change, that okay, this problem is actually bothering us quite a lot. So we should actually do something to identify the potential solution for a particular problem. This second, any area, when I say any area, it should be relevant. We don't see any public health research we actually promote which are really relevant for the population, and we try to identify that who will benefit from this research. Please remember that research is a very heavy investment of resources, investment of time, as well as investment of the skills of the manpower. Therefore, we have to conduct the research in the area which are relevant. When we are generating any fact, that should be trustworthy. So if I am saying that mask is beneficial for prevention of COVID, that fact is actually should be believed by most of the people, and they will find some logic in it. That's what. And this will come only if the high quality of research is maintained throughout. When we are from these facts, when we are suggesting some changes, these changes in health services should be acceptable, affordable, available, and acceptable for the population. And this change, actually, when a change which is suggested having all these 4 A's can actually help in the improvement of health status at the population. This kind of research which I am talking of, public health research, you can see here there are 3 types of researches are on the 2 columns. One is a very basic research where you are conducting the research on animal models. You are trying to identify some drug, or you are trying to identify some solution, which is basically a kind of invention. When this invention is happening, then you try to do the clinical research, which wherein you are testing this intervention on the control group or a group of people, whether it is beneficial or not. So after that, this clinical research, which is actually a testing phase of an intervention, you go for the large scale implementation of public health research. And when I say large scale public health research, which is going to be the research wherein this research is conducted at the population level, wherein the large sample size is involved. So implementation of the programs, or basically at the clinical research level, there is a lot of rigor required to understand that whether the intervention is actually beneficial or not. Let us take the example of Corona-19, how this research helped us. The basic scientists like genome sequencing and helped us to identify the organism and the mutations which happened in the virus, and also along with it, the epidemiologists who are the public health researchers, they have investigated the trends of the disease at the population, where it is spreading, how many cases are spread, what is the projected projected number of the cases we can expect, all that kind of analysis. So basic scientists, in fact, basic research also involved the some kind of public health research. Now the second level comes is the prevention of the COVID. So prevention of COVID, people thought of that one is the vaccine development and testing. That came in first mind, that we should get some vaccine so that this infection can be prevented, and eventually it happened. Also, the behavioral scientists work towards designing the key messages that what people should do to prevent this disease. Public health researchers were focusing on actually studying the trends of the disease in the population, where it is happening, which are the states, which are the districts, which population, children, old age, women, men, where it is happening. So that was the role of public health researchers. While public health managers were ensuring that the health services are reached to the end mile, that means to each village and the rural areas. So the diagnosis part, if we see the biotechnology, diagnostic accuracy and affordable tests were designed, and the RT-PCR came, and the other test came, and now the home testing kits is available. So a lot of research on the diagnostic part has also gone, and the mass vaccine production initiated immediately. And this was the, I guess, record time of any vaccine to develop, tested, and get into mass production. The treatment part also focused on the rapid evidence synthesis, that which medications are working, how to improve the patient care, post-COVID rehabilitation, and of course, the managing the public health situation in these kind of emergencies. So, of course, these kind of researches are happening, but this graph particularly shows that the yellow is our health needs. And in South Asia, particularly in India, our health needs are very high, while the research efforts are that in proportion to that are very less. So another important point to be noted is that we are progressing, no doubt about it. But this progress is not reflected in the health outcomes of the country. We are having a lot of diseases which are related with the poverty, but at the same time, we are also getting diseases which are of the uh, uh, of the development origin, like lifestyle related diseases and so on and so forth. So to tackle this, what actually government is doing? So government is actually launched several programs like Ayushman Bharat. You might have heard about it. The Swachh Bharat Abhiyan, increasing the health expenditure on public health, and many others. So many programs, national programs, regional programs, even at the local level, the state government is launched various programs. Also, for to promote the research in India, government is actually setting up multidisciplinary medical research units, setting up of clinical trial units, and also recognized that evidence-based decision making. When I say evidence-based decision making, that means to develop the policies. The policy makers are looking at the research and they try to understand that how these findings can be used to develop better policies. But as I said, we are already having a lot of health needs, but we are our research effort in proportion to health needs are still very less. And we need trained individual to run and support these activities. Uh, Apart from that, now after COVID, there is a lot of focus on innovations in public health. I just want to take the example of drone delivered medicine supply. Um, using technology to improve the public health professionals, public health response basically. Say for example, the vaccines in the remote areas, when there are floods or when there is the roads are blocked due to natural disasters, etc. Now the vaccines or essential medicines can be delivered by drone, using drones. In our own institutes, actually in Telangana, the IIPH Hyderabad is actually working on some of these technological innovations in medicine, not only in for the sending the medicines through the technology using drones, but also working on the various dimensions of using. Say for example, I'm just giving one example of diagnosis of cancer using artificial intelligence. Now there are apps developed where your saliva actually can detect help detecting cancer by using artificial intelligence. Similarly, the many other screening devices are coming to diagnose the various conditions. I just would like to take the example of one more IT innovations which is being done by PHFI is help in screening the non-communicable diseases through smartphones. So they have actually made a tablet, and in tablet actually there are I guess 8 to 10 tests which actually can be done by especially the blood sugar, the blood pressure recording, and the ECG recording, etc. So there are a lot of innovations are going on in the diagnostic fields also. And with the knowledge of public health, the people who are trained in the diagnostic techniques can actually contribute in the research in this area, and also use of this technology in the for the larger public. So there are many innovations done, but they are not being able to utilize because Sometimes there are no adequate researches are available. Sometimes we don't know how to scale up these innovations for the larger public. So definitely there is a lot of scope coming up with the innovations in public health. The big data analysis is when I say the data of the larger sample surveys which are being conducted in India, like a National Family Health Survey, which is being conducted, and it involves almost 6 to 7 lakh participants. And this big data actually can help us understanding lot of situation, and this there is an involvement of lot of technology in analysis of this data and help us to understand the and find the solution for public health. The one more common intervention which is like we are really looking after for COVID is telemedicine. When I say telemedicine, that means for especially for the remote areas um, where there is a shortage of doctors or health professionals, these facilities can be connected through telemedicine, and the nodal center can be the nearest medical college or tertiary care institution, which is actually, and doctor can be doctor can provide in fact uh, the the solutions, and they can talk, they can examine the patient uh, uh, from the distance, and they can provide the solutions. So this is about, and of course with so many new interventions are coming up as a technology using AI basically, and using various technologies. There is a new opening for now people who are working in the even the technical areas. This actually one of the researches which is being conducted by our own department colleagues, and that shows that till 2026 we are going to have a high requirement of public health professionals in India, and there is going to be a lot of need for the trained public health professionals. So what avenues as a students you have in public health? So one is the at the Delhi campus, we have a Masters of Public Health, which is jointly conducted by PHFI and Academic of Scientific and Innovative Research, which is a Government of India body, and its duration is 2 years, and it is definitely you can many people, those specifically from the life sciences, biotechnology background, they can actually apply for this course. This is one option, which is a 2 years degree course. And what does this course teaches you? This course prepared the students in program organization and management. It prepares students to undertake public health research, which I have talked quite a lot. And it also prepares students to work in socially and culturally diverse settings, by attentive to needs of vulnerable and disadvantaged group. It promotes the leadership qualities of the students, and of course prepare the students for taking teaching and training positions in public health institutions. The second course which we offer is the postgraduate diploma in public health management, which is a 1-year postgraduate diploma. Basically, this diploma is designed with the requirement of National Health Mission of Ministry of Health and Family Welfare. Government nominated candidates are being sent from the various states, and also the self-sponsored candidates can also apply for this. This is also the qualification are almost similar for both the programs. The PGDPHM actually, as I said, is from the designed with the help of National Health Mission. So this same program is offered by various institutions across India, and this is actually called the consortium of PGDPHM partners. Integrated MSc and PhD in clinical research is another important program, which is a 2 years master's program followed by an option to enroll for PhD. Educational qualification of this program is again basically the lab technology, physician assistants, physiotherapy. This particular course focuses on the building capacity of students to participate and they participate in clinical research. The career opportunities in any of the course, any public health course, will depend on multiple things. Of course, your educational background and work experience matters a lot, but your competencies, including competencies, that means your technical competencies, where whatever you have done, whether it is a research or it is a public health, and also your soft skills like communication, the writing skills, all those is really important. Along with it, where you really want to go, your area of interest actually gives you the options for the positions and organizations. So career opportunity in public health are immense, but you will have to work out that where I really want to go, what kind of career path I want to choose. So research competencies after clinical research and MPH, we have reviewing existing evidence, developing grant applications, holding ethics and regulatory approvals, managing a clinical research project, research data analysis, and communicating research result to scientific body. All these competencies are taught both in MPH as well as in MSc clinical research subject. You can actually have different areas of interest after finishing up these courses, like project management, clinical monitor, data management, medical writing, health technology assessment, regulatory affairs expert, or pharmacovigilance expert. Clinical and health research team actually consists of principal investigators, like people who are senior faculty members, like me in my organization will be the public health investigators, because I have conducted I have some experience, some years experience of conducting the region. After that, the team also need a project manager who is able to manage the project at the institute. We have data manager, data analysis, research coordinators, and research associate to perform the duties in the field, quality control and clinical monitors, and research assistants and fellows. So this is generally the general structure of any research team. And as you grow in your career, you can actually get the different positions in this team. So the next questions perhaps you may have is where I can work after finishing up MPH or MSc. You can work in medical college hospitals where the lot of clinical trials or the research projects related to public health work is going on. Private and multi-specialty hospitals with clinical centers, academic and research organizations, government organizations like Central Drug Control Organization, funding agency like ICMR, DST, and DBT, and the non-academic industry-based organization like pharmaceutical company or pharmacovigilance organizations, biotechnology companies, research organizations, clinical data management, and others. The research positions you can get is a coordinators with beginners with a research degree with no beginners with can be of two types: beginners with no research degrees and beginners with research degrees and no experience. But usually for project coordinators, we prefer to have beginners with research degrees. Perhaps they may not have any experience. Managers usually have a research degree and work experience. And research scientists will have a PhD, clinical research, publication, and master's degree with many years of experience. Then you reach on the position of research scientist. So different skills of the course are linked with the job requirements, like conducting literature reviews, critical appraisal of published research, designing research studies, scientific writing, managing research data, ethics, regulatory requirement, communication, etc. And you can have, as I said, you can have a both public health and clinical research career options. Please remember, career opportunities depends on your undergraduate degree, your work experience, your writing and communication skills, and publication. In some job position, publications are requirement, but otherwise, they at a fresher level, you perhaps may not need it. As a public health professional, we have to keep the flexibility of travel, sometimes odd shifts also. On top of it, please remember, nothing can compensate the honesty and hard work. Any career you choose, you have to work honestly and work very hard to climb the ladder of your career path. How you can enhance your CV? As a volunteer, you can assist in projects, you can look for internships in the reputed organizations. You can also do some online free courses like MOOCs in your free time, publish your MSc project work, clear the UGC NET examinations, and that can be useful for getting scholarships. During your project work, assist in writing papers with your supervisors and other than your thesis project. So this is actually, we promote all our students to work towards enhancing their CVs. We do have a multidisciplinary students. All type of students come to us basically from the different streams of life sciences. We have a different career opportunities working in the different organizations with the different job roles. And you have a public health management also, where you can get the multiple opportunities to work as epidemiologist, as a manager, district program coordinators. Many students are in fact working in different positions across country. So some of the employees of IIPH graduates are, you can see here on the screen. Placement statistics in our institute so far remain almost between 90 to 95%. And of course, they are working in development sector, academic research organization, corporate sector, higher studies, etc., etc. For our students, we do have some scholarship. We try to connect with different organizations and organize scholarships for our students who are being enrolled in our program, and we announce those scholarships, and on the basis of the screening and their competencies, we give the partial scholarships to the students. You can use the phfi.org website. You can go there and you see that where which course you want to apply. You have to just need an application form, CV, and 3 references, and your certificate and credentials. We actually usually after application, we shortlist the candidates based on the eligibility criteria. We take the interview of the students and communicate the final decision probably in August. And all courses usually commence between August and September. So these are some glimpses of our campus life. This is the list of the on-campus programs. We do have a range of e-learning programs in a particular domain of public health area, and this is basically useful for professionals who are working in the course. So never stop learning, that's what our motto is, and you can connect on the further information. Thank you very much for patient hearing, and if you have some questions, I will happy to answer. I'm going to stop my um, screen sharing and will be waiting for some questions if you have from the students and audience. Thank you very much.
Thank you so much, ma'am. Can anyone hear me?
Yes. Yeah.
Thank you so much, ma'am, for such a good and knowledgeable session. I think this is going to help our students very much in their career. We are highly obliged that you spared your valuable time for us. First of all, I thank our Vice Principal, sir, for unconditional support and motivation to organize such kind of events. Next, I thank Dr. Ruchi Kamran for giving me this opportunity to be a part of this session. And I thank all the participants for joining the session. Any questions? I hope that everyone is getting something out of this session today that that will be useful for all of us in our lives. Thank you so much, everyone, for joining us today and to listen so patiently. I think there are no questions.
Okay. Thank you very much for this
Okay.
opportunity to share my experience for this on the public health. And we look forward that if any questions are there, they can write to us also. Thank you very much.
Yes. Thank you.